everyone, welcome to Try Right. This is Pack 365, myself Srija. So today in this session you are going to learn about the modifiers used in CPT coding. So what are CPT modifiers? So modifiers, they are the two-digit numbers which are added to CPT codes. So they do not change the procedure code. They always explain the special situations related to how the service was performed. So think of a modifier as an extra node to the insurance company. So why do we use modifiers? So modifiers, they help to show the extra work. They explain the special circumstances. So they always prevent the claim denial and they also ensure the correct payment. For example, there is the same surgery but done with more difficulty. So here the modifier explains why. And next, modify 22, increased procedural services. So that meaning is modify 22, it is used when a procedure required much more work than usual. So when can you use modify 22? Only when the work is significantly greater than normal because of increased time, because of increased intensity, increased technical difficulty or severe patient condition and also extra physical or mental effort. So example, surgery took much longer due to excessive bleeding or severe adhesions. So the documentation is very important. So the doctor must clearly document why the extra work was needed, what made it more difficult and how it was different from a normal case. So without proper documentation, claim may be rejected. And what is the important rule regarding Modify 22? So Modify 22 should not be used with E&M codes. So it is used mainly with procedural or surgical codes. So if the doctor says this case was harder than usual, so you have to think of Modifier 22. So next is Modify 23, unusual anesthesia. So sometimes a procedure that normally needs no anesthesia or only local anesthesia must be done under general anesthesia because of some special or unusual circumstances. So in such cases, modify 23 is added. So when this modify 23 is used when a patient is very anxious or uncooperative, when child or mentally challenged patient is visited and unexpected complications and also pain cannot be controlled with local anesthesia. So example like a minor procedure usually done under local anesthesia is done under general anesthesia due to the patient condition. So this is used mainly by anesthesia providers and must document why the general anesthesia was required. They are not used routinely. So next is modify 24, unrelated E&M service during post-operative period by the same physician or other qualified healthcare professional. So during the post-operative, that is global period, the patient visits the same doctor but for a completely different problem. So in this case, modify 24 is used with the E&M code. So when is 24 used? This visits not related to the surgery. It occurs during the post-operative or global period and this is used when it is seen by the same physician or same specialty. And there is an example, a patient comes for follow-up after the surgery, that is global period, but also visits the doctor for diabetes or hypertension. So the important points here are it must be unrelated to the surgery and the documentation should clearly show different diagnosis. And this 24, it is only used with E&M codes. Modify 25, significant separately identifiable E&M service on the same day. So on the same day, as a procedure, the doctor provides a separate and significant evaluation beyond the routine pre-procedure check. So in such cases, Modify 25 is added to evaluation and management code. So when is Modify 25 used? So E&M service is above and beyond the routine care when it is used by same physician at same day as a procedure. Example is doctor evaluates the chest pain in detail and then he performs a minor procedure. So this is a perfect example for modifier 25. So why this part is saying? So post-operative care. So routine pre-procedure and post-procedure care is already included in the procedure code. So modify 25 is not for routine care. It is used only when the extra evaluation is done. The second point is significant separately identifiable means the doctor must do a proper history, a proper examination and medical decision making. So this must meet the E&M documentation guidelines. And third is same diagnosis is allowed. So the E&M visit can be for same problem. A different diagnosis is not required. For example, patient comes with abdominal pain, he is evaluated and the procedure done. So modify 25, it can still be used if evaluation was significant. So when to use modify 25? When it is done by same doctor, same day, same or different diagnosis, and also separate E&M beyond the routine care, you have to add modify 25 to this E&M code. So modified 25 is not used when the E&M visit resulted in a decision to perform the surgery. So for that situation, use modifier 57. So modifier 25, it is not for non-E&M services. So for those, you have to use modifier 59. So coming to modifier 26, professional component. So what does it mean? So some procedures have two parts. The one is professional part, that is doctor's work, interpretation and report. And the second is technical part, which is the use of equipment, machine and a technician. So modifier 26, it is used when billing only the doctor's work. So there are common services using modifier 26 is X-rays, CT scans, MRI, ECG and ultrasound. So for example, hospital owns the X-ray machine, but the doctor only reads and reports the X-ray. So you have to use CPT code, plus you have to add modifier 26. So what are the important point over here? You have to use only when professional component is billed separately. So hospitals usually bill technical component. So physician bills 26 modifier. Coming to modifier 32, mandated services. So what does it mean? Modifier 32, it is used when the service is done because it is required by law or authority, not because the patient asks for it. So when is modifier 32 used? For government requirement, for court order, for insurance mandate and for employer or a regulatory authority request. So examples like a fitness exam ordered by government or a medical exam ordered by court or immigration medical examination. So these are all considered under modifier 32 mandated services. Next is modifier 33 preventive services. So modifier 33, it is used when the main purpose of the service is prevention, to stop the disease or before it starts. So this is used when evidence-based preventive services are done. UP, USPSTF A or B recommendations. So this is required preventive services under the law. For example, screening colonoscopy, mammography and preventive counseling. So do not use modifier 33 when the CPT code is already a preventive code. So modifier 33 is only for the procedures that are normally diagnostic but done as a preventive ones. Modifier 47, anesthesia by surgeon. So modifier 47 is used when the surgeon themselves provide a regional or general anesthesia. So when is modifier 47 used? When surgeon gives anesthesia, when anesthesia is not given by the anesthesiologist. Example, surgeon performs surgery and also administers the regional anesthesia. So in these cases, you have to assign 47 modifier. And what are the important points regarding modifier 47? They are not used for local anesthesia. They are not used for anesthesiologist. They are used only when anesthesia is separate and as well as significant. Modifier 50, bilateral procedure. So modifier 50, it is used when the same procedure is performed on the both sides of the body during the same session. For example, bilateral, right plus left. So when is modifier 50 used? Same procedure, same session and both sides of the body. So examples are surgery on the both eyes, procedure on both knees, and injection in both shoulders. So important rules. So do not use modifier 50 when the CPT code already includes the bilateral in its description. So the code is always an add-on code. So always check Appendix D for add-on codes. So 50 is nothing but both sides. Modify 51 for multiple procedures. So modify 51, it is used when more than one procedure but not the E&M service. It is done by the same provider in the same session. So how is modifier 51 used? Primary procedure is reported without the modifier and additional procedures is reported with the modifier 51. Example, doctor performs two different surgeries in one session. So second procedure gets 51 added to it. So do not use modify 51 for E&M services, for physical medicine, for supplies like vaccines and also for add-on codes. So some CPT codes are exempt from modifier 51. So for those you have to check Appendix E. So 51 is nothing but more than one procedure performed. 52. Reduce services. So 52 is used when a procedure is performed but not completely. So the doctor decides to do less work than the usual. So when is modifier 52 used? When the procedure partially done, scope or extent is reduced and there is no emergency stopping the procedure. And it is usually no anesthesia involved in this modifier 52. Example, so colonoscopy planned till full length but only part is examined. So imaging study done with fewer views than the normal. So in these cases, you have to assign 52 modifier. So why to use modifier 52? So modifier 52, it always tells the payer the service was reduced. So it keeps the original CPT code but explains less work was done. So what are the important points regarding modifier 52? So you should not use modifier 52 when procedure is stopped due to emergency and procedure is terminated after the anesthesia. So you have to use modifier 53 instead. So for hospital, outpatient and ambulatory services cases, you have to use modifier 73 or 74 but not this 52. Modifier 53, discontinued procedure. So modifier 53, it is used when a procedure is started but had to be stopped because continuing would be unsafe for the patient. So when is modifier 53 used? Procedure started, then terminated. So due to this patient instability, bleeding, severe pain and unexpected complication. Example is surgery stopped due to sudden drop in blood pressure or endoscopy stopped due to breathing difficulty. So these are some examples of modifier 53. So if the procedure is cancelled before anesthesia is given, if it is cancelled before surgical preparation, if the patient simply decides not to continue, so in this cases modifier 53 is not at all allowed. Easy example, a colonoscopy is started. So the patient develops severe breathing difficulty. The doctor stops the procedure. So what is the correct coding? Colonoscopy CPT code plus modifier 53. This is how you have to assign the codes for modifier 53. So for hospital, outpatient or ambulatory surgery center codes cases, the modifier 53 is not used. So instead you have to use modifier 73 for cancelled before anesthesia and modifier 74 for cancelled after anesthesia. And coming to modifier 54, surgical care only. So modifier 54, it is used when one doctor only performs the surgery but does not provide pre-operative or post-operative care. So when to use modifier 54? Surgeon performs only the operation. So another doctor manages the pre-operative care or post-operative follow-up. So easy example is Dr. A performs a fracture surgery. Dr. B handles all the follow-up visits. So Dr. A builds surgery CPT code as well as the modifier 54. So 54 is nothing but surgical, just the surgery, surgical care only. Modifier 55, post-operative management only. What it means? Modifier 55, it is used when a doctor only provides post-surgery care but not the surgery itself. So when to use modifier 55? One doctor performs the surgery, another doctor provides own care, follow-up visit, recovery, monitoring. Easy example, surgeon performs operation in hospital, local doctor manages follow-ups after discharge. So local doctor bills same surgery CPT code as well as the modifier 55. Modifier 56, preoperative management only. So modifier 56, it is used when a doctor only does pre-surgery care but not the surgery. So that means this includes preoperative evaluation, medical clearance, risk assessment and ordering test. Simple words, I prepared the patient for surgery but I did not perform the surgery. So this falls under preoperative management only. And here is an example. So physician A evaluates patient, orders, labs, clears patient for surgery and surgeon B performs the surgery. So physician A bills surgery CPT code as well as modifier 56. Modifier 57, decision for surgery. So modifier 57 used with E&M, evaluation and management codes, when the decision to perform surgery is made during that visit. So this is used mainly for major surgeries during the 90-day global period. So the visit is where the doctor decided surgery is needed. So for such cases, you have to assign modifier 57. Example, patient comes with severe abdominal pain. So doctor evaluates and decides emergency surgery is required today. So in this case, you have to assign E&M code plus modifier 57. So you should not use modifier 57 for minor procedures. So for minor procedures, you have to use modifier 25. 58. Staged or related procedure during post-operative period by the same physician. So modifier 58, it is used when a planned or related procedure is done during the post-operative, that is global period, by the same doctor. So the second procedure was planned or related to the first surgery. So when to use modifier 58? When the procedure is planned, when there is more extensive procedure later, therapy following the surgery by the same physician during the global period. For example, first surgery is removal of the infected tissue. Second surgery is planned, skin graft during the healing period. So how you have to code? You have to code second procedure CPT code plus you have to assign modifier 58 as an add-on code. What is modifier 59? So simply modifier 59 tells the insurance company, yes, these two procedures were done on the same day, but they are separate and independent. So both should be paid. So normally some procedures are bundled together and they are not paid separately. So modifier 59 is used to break that bundle when it is medically correct. So when do we use modifier 59? So you have to use modifier 59 when procedures are not usually reported together but were truly different. So because of differentiation, different procedure, different site or organ system, different incision, different excision, different lesion and also different injury or area. So documentation must clearly support this difference. So think of modifier 59 as saying these are not duplicates, they are separate jobs. So there are easy clinical examples. So first example is a different lesion. So a doctor removes one skin lesion from the arm, another lesion from the back. So even though same CPT code is used, lesions are different. So second code gets the modifier 59. An example 2 related to different site. So colonoscopy with biopsy. So separate control of bleeding in a different area. So they are normally bundled but truly separate. So in this case modifier 59 is allowed. Third example is different session. So procedure done in the morning, another different procedure done in the evening. Modifier 59 applies in these cases. So what modifier 59 is not for? So modifier 59, it is not used with E&M services, not used just to get paid and not used when another modifier explains it better. So important rule over here is if another more specific modifier fits, You have to use that instead of 59. For example, in 58 for stage procedure, 78 for return to OR due to complication, 79 for unrelated procedure, 51 for multiple procedure, and 76 or 77 for repeat procedure. So modify 59 is always a last option but not the first choice. So if the patient returns to operating room due to an unexpected complication, so you should not use modifier 59, you have to use modifier 78. So 59 is always a separate and distinct procedural service. So modifier 59, it should not be used with E&M service. It should not be used with office visit codes. So if a separate E&M visit is done on the same day as a procedure, you have to use modifier 25 but not 59. So modifier 25 is for E&M plus procedure on the same day, whereas modifier 59 is the procedure plus procedure on the separate or distinct site. 62. Two surgeons. So modifier 62, it is used when two surgeons work together as a primary surgeons, each doing different important parts of the same procedure. So both surgeons are main surgeons but not the assistants. So what are the rules for using modifier 62? So both surgeons are primary surgeons, each performs a distinct part of the same surgery, both report the same CPT code. Modifier 62 is added by both surgeons and documentation must clearly show separate roles. And what is an example? Surgeon A, orthopedic part of spine surgery. Surgeon B, neurosurgical part of spine surgery. So for surgeon A, you have to assign the CPT code as well as 62 modifier. And for surgeon B, you have to also add the CPT code and 62 modifier. So if one of the surgeons act as an assistant for another additional procedure, so then you have to use modifier 80 for assistant surgeon or modifier 82 if assistant surgeon when qualified assistant is not available. But do not use modifier 62 in that situation. So modifier 62 is strictly for two surgeons, two main surgeons who are tend to do the surgery. Modifier 63, procedure performed on infants less than 4 kg. So modifier 63 is used when a surgical procedure is performed on a very small infant weighing less than 4 kg. So the baby is very small, so the surgery is much more difficult. So why modifier 63 is needed? So surgeries on very small infants involve tiny anatomy, higher risk, extra time and care, special equipment. So extra reimbursement may be allowed. For example, a heart surgery is performed on a newborn weighing 3 kg. So you have to assign the surgery CPT code plus modifier 63. So what are the important rules for modifier 63? Infant must be under 4 kg at the time of surgery. They are used mainly for major surgical procedures and not used for routine or minor procedures. So why modifier 63 is important? So surgeries on infants less than 4 kg involve very small organs and very small blood vessels, and also special instruments must be needed, higher chance of complications and continuous monitoring. So modifier 63 tells the payer this was not a routine surgery. And when can you use modifier 63? When patient is a neonat or infant. Current weight is less than 4 kg at the time of procedure, and procedure is a surgical procedure, and also code is from an allowed CPT code range. So modifier 63 can be used only with specific CPT codes, mainly from the allowed sections, from the surgery section 20,000 series as well as selected medicine and cardiovascular codes which are listed over here. So these are some codes from medicine and cardiovascular section which are allowed, and this is a series from 20,000 to 70,000, 60,000 series from the surgery. So these are not allowed with these sections. So modifier 63 should not be appended to evaluation and management, anesthesia, radiology, pathology and laboratory, medicine section except the specific cardiovascular codes listed above. Example, baby weight is 3 kg and the procedure is congenital heart surgery. So you have to assign the surgery CPT code as well as the modifier 63. So in these situations, you have to add modifier 63, and this is how you have to use modifier 63 for surgery, some of the surgery CPT codes as well as selected medicine and evaluation cardiovascular section. So this is about 63 modifier. So this is for today's session. I hope this session has helped you. So in the next session, you will be learning about some more modifiers briefly with their examples. Thank you.